So this video clip is going to be all about anatomy, basically what's inside, how it all fits together, how it relates to the urinary system, how it relates to prolapses, and all about where the pelvic floor is, where it sits, what it looks like. Hopefully that will help to get a good picture in your head of what is where. So just talking about what happens in the body to how the urine is produced. So your kidneys are fairly high up. They're just tucked behind the back of the ribs, and that is where the blood flow goes through, is processed and cleaned, and the urine is then taken from the kidneys down through two long tubes called the ureters. They go down towards the bladder. The bladder is a collecting vessel. Below the bladder there is a little short tube called the urethra. That's the part of the system that exits to the outside, and then you've got your pelvic floor muscles that sit around the base of the bladder. So the pelvic floor muscles themselves are right at the bottom of this system. If you look from the side, you'll see that within the pelvis, here's a pelvis, so if we do it sideways like that, so you've got your spine at the back, you've got the pubic bone at the front, and then you've got the cavity of the pelvis where everything sits. So the kidneys are up here, ureters are down there, bladder sits in here. So if we look from the front, from sideways, the bladder sits towards the front of the pelvis. Behind that you'll find the uterus, and behind that you will then find the bowel as well. And they all tuck nicely in there. Obviously the bowel is up here as well in the abdomen, but the main pelvic organs are all sitting in here. So this is what the pelvis looks like from the front. If you look from the inside, you can see that is where the pelvic floor muscles are. All this red area, all of this is muscles. From the outside, it's like that. So at the front, just here, this is the vulva, just here. That's the external genitals. Just at the top there, don't know if you can see that very well, but that's where the urethra is, that's where your urine drains from. Behind that is the vagina, and behind that we've got the anus, the back passage, and all of this area are layers of pelvic floor muscles, and they almost form like a hammock at the bottom of the pelvis that supports everything, and everything sits on top of it. They also have a role in keeping the pelvis stable, supporting the joints of the pelvis. So you've got a joint here, and you've also got two joints at the back there. So along with the ligaments of the pelvis, that gives you stability around here as well. So just talking more specifically about the pelvic floor again. So you've got different layers of muscles. You probably can't really see this all together, but there's a superficial layer of muscles, and then there's the deeper ones, which are underneath here. Now, if you've had an obstetric tear, so when you were having a baby, if you tore, then there will have been some damage around this area. So the vagina is here. If you've had a first degree tear, then it will just be a very small little tear just here. If you have an episiotomy, they tend to cut across this way, okay, just to make the opening a little bit bigger. And sometimes that tears on its own. That's called a second degree tear if it involves just the muscles there, or you can have an episiotomy. It will be in a similar sort of area. A first degree tear really is just involving skin. Second degree involves the muscles, so the superficial muscles and the deeper layers. A third degree tear is a little bit more significant than that, and that is where the tear goes backwards, and it actually there's an extra ring of muscle of pelvic floor just here, just around the outside of the anus. So if you have a third degree tear, it tends to go back and nick into that little reinforcing ring of muscles just there. So a third degree, you can have different degrees of a third degree, it's very complicated, but you can have a 3A, a 3B or a 3C, and that is just really how far it goes and which of the muscle fibres it involves, whether it's the ones near the outside or whether it's the slightly deeper ones. So that's the internal and external sphincter muscles, they're called. And if you have a fourth degree tear, then that will also involve, it will go a little bit further even than that, so it will involve the muscles, the deep and the superficial muscles, and it will also involve the tissues around the anus as well, so the skin tissues as well. So that is where they will do a repair just there. Okay, so that just puts everything back where it should do, so that the muscles will work efficiently. And normally people recover well from these sort of things.